Welcome back to Good Morning Trinidad and Tobago on CTV and Talk City 91.1 FM. We are talking about heart disease prevention, and to do that with us this morning is Dr. Raquel Sukhbir. She's a doctor of internal medicine with a focus on heart prevention, heart disease prevention. I would like to say good morning and welcome to Good Morning Trinidad and Tobago.
Good morning, Rishi.
And you have been trained in the United Kingdom.
Yes, I was. My name is Dr. Raquel Sukhbir. I'm a specialist of internal medicine, but I have a real focus on heart disease prevention. So what internal medicine is, I don't know if you know. Lots of people ask me, what is that?
Yes, what is internal medicine?
It's a specialty that encompasses care and creating harmony in terms of all of your internal organs. So your heart, your lungs, your kidneys, your gastrointestinal digestive system, your blood, your skin, all of them, making sure that they work well together. Your bones, they all kind of interplay. So I coordinate the care of each of those organs and act as like a care coordinator between the specialties. So if you need a procedure, you can then go on to see your cardiologist. If you need a colonoscopy, you can go and see your gastrointestinal specialist, but I manage all of them. But I became really interested and kind of focused on heart disease, especially since coming back to practice in Trinidad, because I don't know if you know that heart disease is our #1 killer. The statistics are quite staggering. It is followed closely by diabetes and then stroke, of course, and kidney disease, but it remains, it really stands out as the #1. And, we kind of have to look at why the risk factors that create that staggering statistic are that a lot of us walking around with high blood sugar, many of us are overweight. That's the #2 biggest risk factor in Trinidad, followed then by poor diet and followed by high blood pressure, whereas in other countries, high blood pressure is the leading risk factor for heart disease. But here in Trinidad, it's sugar, overweight, poor diet, and then high blood pressure. And, the other kind of statistics that I want to share this morning is mortality rates. So the age that we would have our expected life expectancy to. If you compare us to the US, women have a life expectancy here in 2016 of 77, which kind of, closely matches the US at 81, but men are at a staggering 69 years old.
Ugh.
And that hasn't really changed that significantly from 1990 when our life expectancy was 66. And so I kind of, I wonder, what are we not doing or what can we do? And it's something that I really want to address, today and throughout my whole career is, please don't be afraid of the day that you're going to get sick. Please don't live in fear of that day. Just come to the doctor. Most of my patients are, scared when they first come to me. They're worried, what are we going to find? Are we going to find that high blood pressure? Are we going to find that high blood sugar? And what that will mean to their lives. But then, you get a diagnosis 9 out of 10 times, you do find something. And we start working together and they kind of realize, actually, this is a risk factor. High blood pressure can be controlled. And once it is controlled, you kind of don't need to worry about it anymore. Once you start to, change the way you live and also take some medication if you need to, everything becomes so much more manageable. They start to feel better almost immediately. They start waking up, sleeping well, waking up without that tension headache, getting through their days with more energy, less body aches and pains, and just being healthier and feeling better. And our relationship immediately changes from, one of fear to one of partnership and, I dare not say it, but enjoyment. My patients love, they enjoy coming to see me. And I think that's what I want to make health all about, because life is hard enough. We have
enough. Make healthcare enjoyable.
To make it enjoyable. We have enough to worry about, you know, with times being so hard and all of that. I don't want people to think it's this kind of scary monster that might come out of the cupboard.
There are a couple of things that you mentioned. One, with the life expectancy, women it is 77, men 69. Why? Why is that so?
So, well, it's partly lifestyle, partly genetics. So men, when you talk about risk factors, they can be classed into kind of modifiable and non-modifiable. A non-modifiable risk factor is your gender. And so men just genetically are predisposed to the, you know, coming under the kind of ailments that cause premature death a little bit more than women. And also is probably that they don't go to the doctor. They're a bit worried about it. They shy away from getting themselves checked out. And, you know, we can really address those modifiable risk factors, which are, so the first thing is when you talk about heart disease, but lots of chronic diseases in general, don't smoke. Which is, you know, it's not bad actually in Trinidad, the rates of smoking. The second thing is we really need to get moving. So Harvard Health has published a study done on men actually that show that exercise of a moderate intensity, which is about half an hour a day, of something vigorous like brisk walking, gardening, housekeeping, can increase not just your life expectancy by years. So if you exercise like that most days a week, you can actually extend your life by 8 years. If you're overweight, you can extend it by 5. But it also increases your quality of life. So you're living a better life. You get less heart disease. Your brain stays sharp. You get less diabetes. Your bones and joints and everything stay stronger, so that you can move and you don't fall and you don't fracture anything and you don't become frail. And also, it's actually shown to decrease the risk of colon cancer by 30% and lung cancer by 20%. So there's a risk, you know, there's a link to reduction in cancer as well with exercise.
So you have the exercise, but they also have to eat well.
Yes. So I was coming on to the third one, which is diet. And that's, you know, a particular one that we can really work on in Trinidad.
How are we going to work on it? People, you know, fast food is just everywhere. You can just get it. Single people don't cook, and you know, they just buy something and eat. And
I know it's really
it's
tough.
Convenient.
It's convenient.
To eat junk.
I'm not a crusader, and I want to make sure that, you know, we all know that everything is achievable. I was not the healthiest person in the world. And then I learned all of these things, and I started trying to make changes in my own life, and I realized it's possible. And so my clinic is called Gray's Medical. That's what, it's on Alcazar Street in Port of Spain. And it's something that I really tried to achieve at Gray's Medical because, you know, I can give you all this advice, and I will talk about exactly how to eat and try to address that. But it's very difficult to go away and put that into practice. So at Gray's Medical, we have, you know, it's a team, it's not just me. There is someone to help you with your diet, someone to help you exercise. And these are, like, it's a health coach and an exercise physiologist. And they're the experts in nutrition and fitness. But simple things. So diet, you know, we all get confused by these labels, right? Saturated fat, trans fat.
Yeah, just tell me what to eat and what not to eat.
Tell you what to eat and what not to eat. So generally, a diet that is low in animal-rich fats is what to eat. So the Mediterranean diet is something that's been studied all over the world, and they found that those people have the lowest risk and incidence of heart disease and diabetes. And the reason is that their diet is very rich in fruit and vegetables and very low in saturated fat that comes from red meat and fried foods. So an easy rule of thumb that I say to people is, you know, try to make sure that your plate is always balanced. that you have some protein there and you have a little bit of carbohydrate, like the size of your fist, because more than that is going to give us diabetes. And then the rest should be filled with.
I'm probably the most unhealthy eater out there.
Well, it's easy. So you can make small changes. What do you eat now?
Fast food most times.
Doubles?
Yes, I do. I like doubles.
Okay.
But doubles is something that is addictive, you know.
Yeah, I know. I love doubles myself. I think you can do little tricks. So you could say to yourself, for 5 days of the week, I'm going to prepare my food in advance. I'm going to try to be clean and healthy. And then 2 days of the week, I can give myself a break and have something. And if you're going to have doubles, you can have one bar. And the rest
that is a curse to Trinidadians, you know, just one.
Just one. Because you have to lower your carbohydrate and fried food intake. And at home, you know, when you're cooking, you can try to cook as much as you can with olive oil. That's something you can do. Just try to get as much nuts and whole grain in your diet as possible. So oats in the morning, looking at me very dubiously. There's lots of really delicious, healthy snacks out there that consists of nuts. If you're going to eat sugar, you can have coconut sugar instead of, you know, the refined brown and white sugar. There's lots of small changes, tiny changes that you can make that actually make a big difference.
What about coconut oil? I was just asked to find out.
Interesting.
Yeah.
Coconut oil actually, I would say that the evidence shows that extra virgin olive oil is the safest oil to cook with and eat. It's a myth that you can't cook with extra virgin olive oil. You can. It's actually quite a stable oil. So the most important thing is the temperature at which an oil sublimates into fat. And so long as you don't let the oil smoke, it's safe and healthy to cook with. Coconut oil still has, you know, saturated fat.
So that is something that they have to be careful with as well.
Whereas olive oil is polyunsaturated fatty acids.
You want to address the issues that we are discussing. How do you plan to address them?
You mean throughout my career?
Well, throughout your career, I know that you want to help Trinidad and Tobago understand, and how are we going about doing that to ensure that people get the message and they try to take better care of their health?
Okay, so I'm starting with, you know, things like this. So talking to people and just saying, please go to the doctor and get your blood sugar checked, your blood pressure checked. If you're walking past Superfarm, you can go check your blood pressure. But you do need to see your doctor once a year to just check on your cholesterol. And don't be afraid, you know, it's actually really reassuring and less stressful when you know what's there and you start to deal with these things. And they're not problems, they're actually just lifestyle changes that you need to make most of the time. And the second thing is by doing as much outreach as I can. So whenever there's an opportunity for a free clinic, I do it. And that, again, is just checking people's sugars and blood pressures. And I guess we really, in prevention, you know, there's secondary prevention, primary prevention, and primordial. So secondary prevention is if you've already had a heart attack or a stroke, trying to get you to make sure you don't have another one. Primary is trying to, in the people who have high blood pressure and diabetes, coming to see me and getting that really well controlled so you don't have a heart attack or a stroke. And then primordial is at our population level. So I think, you know, that requires a lot more rigorous standards where we can make fruit and vegetable and healthy food cheaper and more readily available. Meals in schools need to be really looked at. And they are. This is all being done.
So it's a good start.
It's a good start. The awareness of this in Trinidad is there. I'm really sure of it. I think people we just feel that it's you know, it's a very big change, and that's what I'm here to kind of prove, that it's not that hard.
And you will be
very
willing to speak
achievable.
with people. I know you have
All
a
the time.
practice as well. Where are you located? And if people want to come and meet with you, how do they do that?
So Gray's Medical, it's located on Alcazar Street in Port of Spain. You can call 235-3604 or check out our website, www.graysmedical.com. Grays with a A, Gray. I also am going to start doing like a free health screening, which is going to be on one, unfortunately for now, Monday of the month, where we just, you can just walk in and we check blood pressures, blood sugars, calculate something called your body mass index, which is, your height and your weight and working out your correct weight. And you could even have a free assessment from one of the physiotherapists. So we have, it's doctor, physiotherapists, exercise physiologist, and nutritionist working all together.
So people can come to your office and, get checked up. It is the way to go. It is the thing to do. Men, 69 years. We have to do better than that. 69 years is not enough. Women outliving us by 8 years. We need to balance this off, right? So I would like to thank you, Dr. Raquel Sukhbir, Doctor of Internal Medicine, focus today on heart disease prevention. It was a pleasure speaking with you. We've learned a lot, and hopefully people can take some of your advice and, try to eat healthy and do the things that will prevent them from, getting a heart attack or any other of those diseases.